The core aspects of disease in pathology. Pathology is the study of disease by scientific method. The word pathology came from the Latin word patho and logi. Patho means disease and logi means study. Therefore, pathology is a scientific study of disease. Diseases may in turn be defined as an abnormal variation in the structure or function of any part of the body. Pathology is the explanation of a disease by studying the following four aspects of the disease. That is, the first one is etiology, and second one is pathogenesis, third one is morphologic changes, and the fourth one is the functional rearrangement and the clinical significance. While speaking about the etiology of a disease means the cause of the disease. If the cause of disease is known, it is called primary etiology. If the cause of disease is unknown, it is called idiopathic. Knowledge or discovery of the primary cause remains the backbone on which a diagnosis can be made. A disease understood and the treatment developed. There are two major classes of the etiologic factors. The first one is genetic and acquired. In acquired, we can say infectious, nutritional, chemical, and physical, etc. The detailed discussion will be given in the subsequent topics. The etiology is followed by pathogenesis. Second one is pathogenesis. This means the mechanism through which the cause operates to produce the pathological and the clinical manifestation. The pathogenetic mechanism could take place in the latent or the incubation period. Pathogenesis leads to the morphologic changes. And the third one is morphologic changes. The morphologic changes refers to the structural alternation in the cells or the tissues that occur following the pathogenetic mechanism. The structural changes in the organ can be seen with the naked eye, or they may be only seen under the microscope. Those changes that can be seen with the naked eye are called the gross morphologic changes, and those that are seen under the microscope are called microscopic changes. Both the gross and the microscopic morphologic changes may only be seen in the disease. They may be specific to the disease. Therefore, such morphologic changes can be used by the pathologist to identify the disease. In addition to the morphologic changes, this will lead to the functional alteration or to the clinical signs and symptoms of the disease. The fourth topic here is the functional rearrangement and the clinical significance. The morphologic changes in the organ influence the normal function of the organ. By doing so, they determine the clinical features like signs and symptoms, cause and the prognosis of the disease. In summary of the pathology studies, the first one is etiology. This leads to the pathogenesis, and this leads to the morphologic changes, which at last causes the clinical features and the prognosis of all disease. Understanding of the above core aspects of disease, that is understanding the pathology, this will help one to understand how the clinical features of the different disease occurs and how the treatment works. This understanding will in turn enable the healthcare worker to handle and help their patient in a better and the scientific way. It is for this reason that the health science student should study the pathology. In addition, the pathologist can use the morphologic changes seen in the disease to diagnose the different diseases. There are different diagnostic modalities used in the pathology. Most of these diagnostic techniques are based on the morphologic changes. The diagnostic techniques used in the pathology is, the pathologists use the following techniques to the diagnose disease. The first one is histopathology, and the second one is cytopathology, hematopathology, and the immunohistochemistry, microbiological examination, biochemical examination, cytogenetics, molecular techniques, and autopsy. Histopathology techniques. The first one is, while speaking about the histopathological examination studies the tissues under the microscope. During this study, the pathologist looks for the abnormal structure in the tissue. Tissues for the histopathological examination are obtained by biopsy. Biopsy is a tissue sample from a living person to identify the disease. Biopsy can be either incisional or excisional. Once the tissue is removed from the patient, it has to be immediately fixed by putting it to the inadequate amount of 10% of the formaldehyde before sending it to the pathologist. The purpose of fixation is to prevent the autolysis and the bacterial decomposition and the putrefaction, to coagulate the tissue to prevent the loss of easily diffusible substances. and to fortify the tissue against the deleterious effects of the various stages in the preparation of section and the tissue processing. And the fixation is also used to leave the tissues in a condition which facilitates the differential staining with dyes and other reagents. Once the tissue arrives at the pathology department, the pathologist will examine it macroscopically, that is with the naked eye examination of tissues. Then the tissue is processed to make it ready for the microscopic examination. The whole purpose of the tissue processing is to prepare a very thin tissue, that is 5 to 7 μm or 1 cell thick tissue, which can be clearly seen under the microscope. The tissue is processed by putting it into the different chemicals. It is then impregnated, that is embedded in the paraffin, sectioned, cut into thin slices and is finally stained. The stains can be hematoxylin or eosin stain or the special stains such as PAS, immunochemistry, etc. The hematoxylin or the eosin stain is usually abbreviated as H&E stain. The H&E stain is routinely used. It gives the nucleus a blue color. The cytoplasm, the extracellular matrix, is in pinkish color. Then the pathologist will look for the abnormal structures in the tissue, and based on this abnormal morphology, he or she will make the diagnosis. Histopathology is usually the gold standard for the pathological diagnosis. While speaking about the cytopathology technique, this is the study of cell from various body size to determine the cause or the nature of a disease. Here we can look for the application of the cytopathology. The main application of the cytology include the following. The first one is the screening for the early detection of the cytomatic cancer. For example, the examination of the scraping from cervix for early detection and the prevention of the cervical cancer. And the second one is diagnosis of the symptomatic cancer. Cytopathology may be used alone or in the conjugation with the other modalities to diagnose the tumor revealed by the physical or the radiological examination. It can be used in the diagnosis of the cyst, inflammatory condition, and the infection or the various organs. And the third one is the surveillance of the patient, which is treated for the cancer. For some types of cancer, the cytology is the most feasible method of surveillance to detect the recurrence. The best example is periodic urine cytology to monitor the recurrence of the cancer of the urinary tract. While speaking about the advantage of the cytologic examination, compared to histopathologic technique, it is cheap. This takes less time and needs no anesthesia to take the specimen. Therefore, it is appropriate for developing countries with the limited resources like Ethiopia. In addition, it is complementary to histopathological examination. While speaking about the cytopathologic methods, the first one is fine needle aspiration cytology. The cells are obtained by aspirating the diseased organ using a very thin needle under the negative pressure. Virtually any organ or the tissue can be sampled by the fine needle aspiration. The aspirated cells or then stained are understudied under the microscope. The superficial organs like thyroid, breast, lymph node, skin and the soft tissues can be easily aspirated. Deep organs such as lung, mediastinum, liver, pancreas, kidney, adrenal gland and the retroperitoneum are aspirated with the guidance by fluoroscopy, ultrasound or CT scan. The fine needle aspiration cytology or cytopathology is cheap, fast and accurate in diagnosing the many diseases. While speaking of the exfoliative cytology, this refers to the examination of a cell that are shed spontaneously into the body fluids or the secretion. Examples include sputum, cerebrospinal fluid, urine, effusion in the body cavities like pleura, pericardium and the peritoneum. And we can also say the nipple discharge and the vaginal discharge. While speaking about the abrasive cytology, this refers to the method by which the cells are dislodged by various tools from the body surfaces. For example, skin, mucous membrane and the serous membrane. Preparation of the cervical smear with the spatula or a small brush to detect the cancer of the uterine cervix at the early stage. Such cervical smears are also called the pap smear. They can significantly reduce the mortality from the cervical cancer. This is the most common cancer in the Ethiopian women. And the one more examination is the hematological examination. This is a method by which the abnormalities of the cell of the blood and the precursors in the bone marrow are investigated to diagnose the different kinds of anemia and the leukemia. Hematological examination is to diagnose the different kinds of anemia and the leukemia. Immunohistochemistry. This is a method that is used to detect the various specific antigen in the tissue in order to identify the type of disease. For identifying the type of disease, we can use the immunohistochemistry. And next one is microbiological examination. This is a method by which the body fluids, exist tissues are examined by the microscopical, cultural and the serological techniques to identify the microorganisms responsible for the many diseases. And the next one is the biochemical examination. This is a method by which the metabolic disturbances of the disease are investigated by the assay of various normal and the abnormal compounds in the blood, urine, etc. Cytogenetics. This is a method in which the inherited chromosomal abnormalities in the germ cells or the acquired chromosomal abnormalities in the somatic cells are investigated using the techniques of molecular biology, that is H molecular techniques. Different molecular techniques such as fluorescent in situ hybridization, southern blot, etc. can be used to detect the genetic disease. Cytogenetics is used to detect the genetic diseases. Autopsy. This is the examination of a dead body to identify the cause of death. This can be forensic or the clinical purposes. The relative importance of each of the above disciplines to our understanding of a disease varies for the different types of disease. For example, in diabetes mellitus, biochemical investigation provides the best means of diagnosis and is one of the greatest value in the control of disease. Whereas in the diagnosis of tumors, fine needle aspiration cytopathology and the histopathology, they contribute most. However, for most of the diseases, diagnosis is based on the combination of the pathological investigation. Here we can look for the cause of diseases. Disease can be caused by either environmental factors, genetic factors, or a combination of the two. In case of environmental factors of a disease, there are many and are classified into physical agents, chemical, nutritional deficiency and excesses, and the infections and the infestations, immunological factors and the psychogenic factors. While speaking about the physical agents, these include trauma, radiation, extremes of temperature and the electric power. These agents apply the excess physical energy in any form to the body. While speaking about the chemicals, with the use of an ever increasing number of the chemical agents such as drugs in industrial processes and at home, chemically induced injuries has become very common. Their effects vary. Some act in the general manner. For example, cyanide is a toxic to all cells. Others act locally at the site of application. For example, strong acid on the caustics. Another group, they exhibit a predilection for the certain organs. For example, the effect of paracetamol and alcohol on the liver. Many toxic chemicals are metabolized in liver and excreted in kidney. As a result, these organs are susceptible to the chemical injury. Nutritional deficiencies and excess nutritional deficiencies may arise as a result of poor supply interference with the absorption, inefficient transport within the body, or the defective utilization. It may take the form of deficiency either of major classes of food, usually protein and energy, or the vitamins or elements essential for the specific metabolic processes. Example, iron for the hemoglobin production. Often, the deficiencies are multiple and complex. On the other hand, dietary excess plays an important role in the disease in the Western countries. Obesity has become increasingly common with its attendant danger of the type 2 diabetes, high blood pressure and the heart disease. Infections and the manifestations and infestations. Virus, bacteria, fungi, protozoa and metazoa all cause disease. They may do so by causing the cell destruction directly, as in the virus infection, for example poliomyelitis, or protozoal infection, for example malaria. However, in others, the damage is done by the toxins elaborated by the infecting agent, as in the diphtheria or tetanus. Like chemicals, they may have a general effect or they may show a predilection for the certain tissues. While speaking about the immunological factors, the immune process is essential for protection against the microorganisms and the parasites. However, the immune system can be abnormal, which can lead to the diseases. The abnormalities of the immune system include hypersensitivity reaction. This is exaggerated immune response to an antigen. For example, bronchial asthma can occur due to the exaggerated immune response to the harmless pollen. Immunodeficiency. This is due to the deficiency of the component of the immune system, which leads to the increased susceptibility to the different disease. An example is AIDS. While speaking about the autoimmunity, this is an abnormal immune reaction against the self antigen of the host. Therefore, the autoimmunity is a hypersensitivity reaction against the self antigen. For example, type 1 diabetes mellitus. It is caused by the autoimmune destruction of the beta cells of the islets of Langerhans of the pancreas. And the last one is the psychogenic factors. The mental stresses imposed by condition of life, particularly in technologically advanced communities, they are probably contributory factors in some groups of diseases. These are all the environmental factors that are causing the diseases. When speaking about the genetic factors, these are the hereditary factors that are inherited genetically from parents. While speaking about the course of diseases, the course of diseases is shown with the simplified diagram. The first one is exposure, biological onset, clinical onset, permanent damage and death, and they also lead to the latency period. The course of a disease in the absence of any intervention is called the natural history of a disease. The different stages in the natural history of a disease include exposure to various risk factors, that is causative agents. And the next one is latency. This is the period between the exposure and the biological onset of disease. And the third one is the biological onset of disease. This marks the initiation of the disease processes. However, without any sign or symptom, the following biological onset of disease, it may remain asymptomatic or the subclinical, that is without any clinical manifestation, or may lead to the clinical disease. And the last one is the incubation, that is induction period. This refers to the variable period of time without any obvious signs or symptoms from the time of exposure. The clinical onset of a disease, when the signs and symptoms of the disease become apparent. The expression of a disease may be variable in the severity or in terms of range of manifestation. The onset of permanent damage and death. The natural recovery, that is the recovery without any intervention, can occur at any stage in the progression of a disease. And the last one is the outcome and the consequences of a disease. Following the clinical onset, the disease may follow any of the following trends. The first one is the resolution. They can occur leaving no sequelae. And the second one is the disease can settle down but sequelae are left. And the third one is it may result in death. The final topic is clinical and the biological death. Clinical death. This is a reversible transmission between the life and the biologic death. The clinical death is defined as a period of respiratory, circulatory and the brain arrest during which the initiation of the resuscitation can lead to the recovery. The clinical death begins with either the last agonal inhalation or the last cardiac contraction. The signs indicating the clinical death are the patient is without the pulse or the blood pressure and is completely unresponsive to the most painful stimulus. The pupils are widely dilated. Some reflex reactions to the external stimulation are present. For example, during intubation, the respiration may be restored in response to the stimulation of the receptors of the superior laryngeal lobe. The nucleus, which is located in the medulla oblongata near the respiratory center. Recovery can occur with the resuscitation. Biological death. The biological death, this is the sure sign of death, which sets in after the clinical death. It is an irreversible state of cellular destruction. It manifests with the irreversible cessation of the circulatory and the respiratory function or the irreversible cessation of all functions of the entire brain, including brainstem. However, one should notice that there are internationally accepted criteria to diagnose the biological death.